Hello and welcome to North Country Matters. My name is Donna Seymour. I'm a member of the St. Lawrence County branch of the American Association of University Women, one of the civic partners for this show. Today we have Jeanette Zoeckler, sorry Jeanette, from the Occupational Health Clinic Center in the studio. Jeanette, welcome to North Country Matters. You've come up today from Syracuse, which is where you're based, but actually the clinic serves 26 counties in New York, the northern part of New York State. So could you explain a little bit about what you do
Sure.
and where you are located?
Mm-hmm. Well, the clinic up here in Canton is an occupational health clinic that serves people who get sick or hurt in the workplace. Up here in these counties, there's 7 counties I think in the North region. But this is part of an occupational health clinical network, which is a statewide network of similar clinics that serve the same population of workers, people who work, who have been hurt or made sick in the workplace. And I'm based in the Syracuse office, which serves the central New York region, and we also have a clinic in the southern tier. So the Syracuse office is sort of the home base for the 2 other regional clinics, and altogether we serve 26 counties.
So, and you do what for, what's your specific job title for the clinics?
Sure. Well, I'm a project manager there. I manage special projects that are related to public health and prevention of occupational health disease and injuries as well, also fatalities. So we're looking into preventing these things from happening in the first place. But I should mention that the clinic is a comprehensive program that has certainly high-quality medical care. Also, we have social workers available. We have industrial hygiene, which is a field that looks into the specifics, the scientific specifics of workplace hazards and tries to ameliorate them. We also have a strong administrative team, and the outreach and education component is also really important to the the clinics. So there's medical doctor in place, and there's nurse practitioners, and we serve the patient's medical needs, but there's also other components to the program.
Okay, and if you could describe a little bit for us who you serve, what does your client base look like?
Mm-hmm. Well, we serve working men and women, adults mainly, because there's not too many people working that are younger. They shouldn't be. And so people who wonder if their symptoms are work-related can come to us and figure out whether or not their symptoms are related to their work. They get that expertise of being able to tease out that if they're curious or wondering. Also, for those whom it's clear that their occupational illness is work-related, we're seeing those patients. They're often, most of the time, on workers' compensation. So we assist with that process of helping people navigate that payment system. So workers' compensation patients, but not all seek payment that way. So we serve as an independent voice for people when they have issues with their health related to their work.
And you also serve people who perhaps have retired from an industry where they have some work-related issues that have affected their health in later years, right?
Yeah, that's really true. Sometimes when people develop an illness or an injury from the workplace, it's a lifelong chronic problem. Also, some things have latency periods where they don't appear in younger years, and then they can show up later. So certainly across the lifespan, mostly adults, and through retirement age.
Right, very good. The reason that we're here today is we're going to talk about the Low-Wage Workers Health Project, and that this is the report from that, and I know we can put this up on the screen for our watchers. This was a collaborative project, Jeanette. So tell us, who were the partners that worked to do this low-wage worker project?
Well, early on, I noticed that there was an advisory board member on the North Country Clinic, George Gonos, and he was teaching at SUNY Potsdam, and had coffee with him in Canton and realized it'd be really wonderful to tap into his expertise as a sociologist. So that began some conversations about what kinds of project we might do to look at the social aspects, not only asking about people's health conditions, but also a wide variety of conditions around their work. So he was one of the key visionaries that helped helped us out. Also, we have had funding from the Workforce Development Institute, which is a statewide agency that has an interest in how the workforce is developing, what kind of jobs are becoming available and are available to folks on the ground. And so they are very interested in knowing what it's like for people as they enter the workforce or as they experience work.
Right, and their local fellow is Greg Hart, and I actually had Greg Hart in the studio earlier this semester, and he talked about a lot of the work that they do and how they do collaborate with other organizations.
Greg Hart has helped us out, and also the folks right from the Syracuse regional office, Mary Ellen Mendino and David Goodness now has taken over for her. But so they've been a big support, and also we have the medical director of the clinics, and that a lot of people help with this. So there's sort of people who are named officially, and then there's a lot of people in the community who are on board and supportive as well.
Right, not to mention all of the people that you interviewed and whose stories you were able to collect.
Sure.
So this study focuses on the effect of low-wage jobs on workers in the Syracuse area, but the study really reflects trends that are happening nationally, as well as things that are happening within all of your 26 county region, correct?
That's correct. I think that our work was inspired in some ways by several really major studies that have been done in large cities. For example, there have been studies that looked at a sites, like take New York, Chicago, and LA and combine what's going on with the low-wage workers in those communities. There was one especially impressive done to look at their legal issues, but often they don't think about the actual health issues, so we wanted to focus a little bit harder on the health issues. And also we're kind of inspired by some work that's been done in Boston. So this is kind of an attempt it's a smaller attempt because those are large cities with special needs and different environments, but it's an attempt to ask the same questions and see if the national trends are occurring in our smaller city of Syracuse, New York.
Right, okay. Describe for us what kinds of jobs are included in the study that you did, because you looked at some specific types of work.
Certainly, I think that we are out to get into our community, and in doing that, we're not as concerned about making sure that everything is completely representative of exactly what you should be seeing in Onondaga County. But we were really happy that in the end we were able to get quite a spread of occupations. So people involved with low-wage work are the people that are doing the basic work of our society every day. They're all around us. Cleaning buildings, serving food, engaging in construction. They're healthcare workers, on the low end of the healthcare spectrum, so taking care of the elderly, taking care of sick people. They're often, in retail operations, cashiers. When we did the survey, we were able to access 275 people who were working within the last 6 months or so. And there were transportation workers, there were office workers, so we were pretty pleased that we were able to get a nice spread of the occupations that are typical for low-wage. Low-wage work is comprising over 20% of the work done in this nation now across the United States. So it's a big chunk of the people in our communities now. So I think it was nice to hear from a wide variety. Manufacturing as well, was on the decline, really.
Well, and one of the things that we know that since the economic downturn of about 2008, we lost a lot of jobs nationally. We certainly lost a lot of jobs in New York State regionally, and a lot of the so-called new jobs that have been created are jobs that fit into this low-wage work category. So, and it's in many cases very hard physical labor. I mean, certainly if you're taking care of people in the healthcare industry, that's a lot of physical work too, because there are often people who need help to be moved and things like that. So that's really, it's a lot of hard work, for sure. One of the things that your study looked at was the health risks that these low-wage workers are experiencing. Tell us what you found when it comes to the conditions that these folks are actually working in.
Well, given that we're in a clinic, we do see quite a few people that come to us with physical symptoms from their work. So we weren't terribly surprised about the actual health hazards that they experience. There's exposure to dusts, there's exposure to mold, there's exposures to bloodborne pathogens, there's exposure to heavy lifting, as you talked about, exposures to plastics. Repetitive motion is really, really important thing to understand that people are experiencing in the office setting and in other settings, manufacturing settings. People are exposed to chemicals quite often, and that gets into training, and whether or not they've been trained to handle the chemicals is really important. But those are the kind of physical exposures, and I would be remiss if I didn't mention some of the mental exposures that immediately people start expressing when you speak with them, or even on the survey we had open-ended times when people could communicate. A lot of times it's worries and stresses that they take home from the job about their work and about whether or not it's precarious. And that, by that I mean what the work arrangement or the agreement you have with your employer about what you're doing and how long you'll be doing it, who's actually paying you, and the changing hours from week to week is really a key feature of low-wage work. It's really troubling because people can't get on a rhythm in their lives. Their hours change week to week. They have to struggle with arranging childcare and transportation on erratic schedules that can really destabilize their finances. So
not to mention their family life.
Well, of course, all of
right.
these things kind of combine together, and it provides a certain kind of exhaustion that I think is hard to measure, if you will, or hard to get at. But that sort of exhaustion of sometimes having to take on a second job, and that job also has erratic schedules and troubling kind of concern of, most of these people reported that they wouldn't expect to be in that job more than 2 years. I think a good strong percent, maybe 40% or so, didn't expect to be in 6 months. They weren't sure this job would hold. And I think that kind of instability is something different now. When we lost the mid-wage jobs, those were jobs that you could that made living wages and had a stability to them. What we gained was the lower wage jobs that also have this element of instability, temporariness.
Right,
Yeah.
and I know this is something that's been in the news a lot lately has been the issues around, as you mentioned, particularly the scheduling issues. There's actually scheduling software now that companies can use that may end up saying, well, I need you for 3 hours this morning, but I want you to go home and then come back for 4 hours this afternoon, without any understanding of what kind of an impact that actually has. You may be working 7 hours a day, but you're working a split shift, and that may be extremely difficult to match everything else that you're doing. Tell us a little bit, Jeanette, about what the average wage these low-wage workers are going, because we know what minimum wage is, but that's very different than what a living wage is, and particularly in New York State, where a lot of cost of living are very high.
Right. So, Syracuse itself doesn't have a terribly high cost of living. And I think that the living wage was our definition. If somebody wasn't making a living wage, then we were including them. And our sample of 275 people, the average wage was $9.65. Generally speaking, people believe in the community that we need about $12 to $14
Right.
for a single person to make it. So the living wage is much higher than the minimum wage. And I think a lot of people reporting that they're willing to put up with this low wage with the idea that it will improve, but they're not seeing that kind of improvement. So we used to have an entry-level job where you kind of knew you were making low wages, but before long, you would have an increase. But people are reporting sort of what one person called garbage can raises. They aren't enough to be actually meaningful, and it doesn't create any kind of pathway
Right.
for a career. So the wages are low, they stay low, and that causes people to keep searching for other types of work and other types of work arrangements that they think may lead to something better.
Right, and of course the other thing that we know is that these low-wage jobs are turning out to be permanent, not temporary, that people are not getting out of the pathway that they're in with a low-wage job, and that is only adding to the stress because we've seen the world of work really change, and not for the better for anybody that is in that pathway. People, particularly politicians, like to say that they don't want to see the minimum wage raised because they think it's only teenagers who are taking minimum wage jobs, and that is far from the truth. You're seeing people in minimum wage jobs that go across the age spectrum, I'm sure, and you
That's
saw that
correct.
in this survey. What was the age spread that you actually surveyed in your clients?
The age spread is far. I mean, we're not really thinking about people under 18 for our work. So 18 years old, and I think the oldest person might have been in their early 60s or mid 60s.
Okay.
There are, nationally the trends are as you described, but locally also we see people working longer, working into retirement, picking up work they need to survive. And also young folks are particularly vulnerable because they're trying so hard to establish themselves. And I think that the financial picture is threatening to people because it's not that they need a lot of materialism going on. They often express that. What they need is a kind of plan that's going to make a good story for their life. And they are finding a really hard time making their way to that. And I think it's striking the threat of going into deep poverty. We see people in and out of homelessness at some of these folks. But I think besides wages, which are highly impactful on health, very important if you can't afford healthy food, if you can't get yourself to the doctor, there's a lot of reasons why as a public health issue, low wages and the threat of deep poverty is a severe problem. But I think for us too, when we consider people's health, one of the findings that was particularly striking out of this survey was we asked it twice we asked the question, are you in pain from your work that you believe is related to your work in the last month, say? And when we asked it one time, we got a rate of 38% reporting yes. Another time we asked it, it was 31%. So somewhere in the 30% range, upwards almost to 40%, of people experience pain, physical pain, in the course of their work. Now, we know that not all of those people are presenting to a physician. Only 17.5% said they were going to go to the doctor. They did go to the doctor over that pain. But there's a significant bunch that to us, we'd like to prevent them from having the serious problems that develop. And I think that we were somewhat even surprised ourselves that so much physical pain is going on in the low-wage population, and it's a very concerning thing. And also I asked them about the numbers of symptoms, and I think the majority of folks had one or two symptoms, but some 40% had 3 or more symptoms going on. So that meant they had maybe breathing problems in addition to musculoskeletal problem, in addition to some other sort of issue related to pain that their workplace was causing symptoms. And I think that that's an important complexity that we have to think about, that there's multiple things that people are experiencing from their work, and it can be stress related and it can be related to the physical space.
Right, and one thing we know is that stress has physical manifestations, that's for sure. Let's take a little look at some of those health issues. What were the kinds of injuries and health conditions that you found workers were experiencing in the course of this study?
Well, the biggest one is muscle or joint pain as well as back pain. I mean, that accounts for the majority of it. People were also reporting headaches, skin rashes, difficulty breathing, and one person reported a broken bone, I think, as well. One thing when we look at that, what we know about people's experience is we're wondering why more people weren't speaking about their difficulty breathing. We would have thought we would have seen a greater percentage. But it really does show that the main thing is the physical wear and tear, It's either through too much lifting or too repetitive, too fast. A lot of times there's pressure to move faster than the body is really actually should be moving, especially over long periods of time, over years. So, and I really think that a lot of the literature shows, and maybe we didn't ask it directly, but indirectly, that sleep patterns and this exhaustion that I described earlier ends up being a really important part of what people are, threatens their health.
I'm also suspicious that a lot of these workers, because they're in a low-wage job, are not getting much in the way of training either, in terms of just saying this is how you lift, or these are the mechanisms that we have to make sure that you can lift safely, or to cause some of those skeletal-muscular things. But is that a problem too, in terms of, you think it's just lack of training and lack of awareness about what some of these conditions can be related to?
Absolutely, you hit it right on the money. The lack of training manifests itself in so many ways. Some 19% of these surveys were conducted in Spanish because people speak Spanish. Okay,
And that's in the Syracuse area.
Right.
Which,
this was in our urban.
Which we
yeah.
don't think of necessarily.
Right. We may not
as-
see that up here, but
Right.
my point is that a lot of times the health and safety training isn't in a language that people can speak. And if you're not in an area where the multilingual thing like that is the problem, a lot of times it's a literacy rate. Training is presented in a way that the person's literacy isn't compatible with the training. But most often, it's the absence of training. The employers think of these people as temporary, whether they have a specific temporary arrangement or not. There's that precarity I talked about. So they don't invest much in training. It's quick, it's sort of official, what OSHA probably says you have to do, but it doesn't necessarily relate directly to the kinds of work that the person is doing on a daily basis. So it's more perfunctory and not as connected. So indeed, the training is lacking, the focus on it, and also the enforcement of it, because if you have a work group, they want to do the work faster. A lot of times the fastness that's being demanded sort of puts the safety at second place. Right. So a lot of what we call work culture, the culture of safety at work, whether it's supported or not, whether you can stop the line, whether it's supported to you to slow down, to put on your mask or wear the gloves, whatever the protection is that you're supposed to be using is often just sort of secondary. Also, rather than just having protective equipment, sometimes it would be better to change the whole process of how the work is done, and there's a lot of resistance, on the part of employers to do that.
That's right.
So, yeah.
What happens to these workers who have these work-related injuries? We know that a lot of low-wage workers don't maybe have access to health care through their employer, or they may not have insurances that are provided through their employer. So that means that you're in a low-wage situation, and yet you're thrown on your own resources when it comes to getting health care. And we know that there are probably situations where doctors are reluctant to take on a work-related industry. So how does that impact the health of these folks? Are they not seeing doctors, and are they not getting the care they need?
Well, I think that that's really, really something that we see out in the community. And number one thing that prevents accessing a good quality health care related to occupational health is the threat or the worry that if you speak up about this being work-related, you may be terminated. Not directly, but suddenly you're being written up, suddenly you're being watched. A lot of times now the mood in the room changes. Even your coworkers distance themselves from you because if you've got a health problem, they don't want to be seen as part of a problem. So it becomes difficult to be able to speak up about it. Then you have the problem of doctors not wanting to take workers' compensation. It's a difficult system to navigate. There's a lot of paperwork, and it's very difficult on the patients and also on the medical system that's trying to serve the patients. Then on top of it, sometimes there's just a lot of requirements for the patients to be seen, routinely, and it's difficult to be transported. So I think, to have transportation and to make time. I think getting the amelioration for their work-related injury or illness, there's a lot of barriers. Mm-hmm. And so we do know that people go without care, and it can become more serious later, so that's really worrisome. And then also, the system in place in order to pay for it is the workers' compensation system, and it's not being, used for what it was meant to do very often. So that is a real concern of ours, to be able to get the word out to people that are working about the rights that they have and how they can exercise them if they don't feel they can exercise them, to think about ways in which they might.
So it sounds like we need to create some multiple pathways for people in this situation, because they aren't in a work-related situation that is friendly to them when they do get hurt. And so we need to find ways to support them that are not going to actually impact their ability to hold that job, which they clearly need.
They clearly need to keep their jobs, and I think that there's just been a lot less unionization of work. Mm-hmm. And in the past, the traditions of unions, there was a place for at least workers to go. And whether or not there was a union at a workplace, if the majority of the workplace culture is unionized, then say for mid-wage work or what we think of as blue-collar work, then the culture, even for those who aren't unionized, is similar, right? There's a pathway. But the low-wage employers, I think, have created less of an opportunity for workers to discuss their workplace problems with each other or find a way to a path through the maze of that. And so they are kind of on their own and floundering, although, you know, some do find their way, of course. But I think that one of the main focuses of the Low-Wage Workers' Health Project is to be out in the community, helping in a way. Just by me asking all these questions, it raises awareness and helps people be educated about what dangers there are and what might be done if anything happens.
Well, one of the things that you do when you interview people like that is you hear a lot of stories, and you found out a lot about what people's situations were, both not only physically for themselves and how they are working, but in terms of some of these workplaces. You also heard a lot of stories about that, and there are existing laws which are on the books, and they have been created to protect workers, but they're not always being followed, are they? And the regulatory system and the investigation system doesn't seem to be meeting these needs very well, does it?
Well, in other countries, there's a lot more attention given to the regulation of workplaces. And when you study some of those countries and what goes on, you can see that there's much more systematic attention. But our OSHA, the Occupational Safety and Health Administration, hasn't always had the energy and the funding behind it to be able to carry out enough inspections, or to really regulate. So, you know, there are laws and they can be used. There are certainly avenues that people can go down, but they're hard to access, and sometimes people will weigh whether having that extra hassle of having to have a claim or having to chase down the laws is really going to be beneficial for their lives to have that sort of extra thing going on. So I kind of respect that when I run into people. They know that some of the whistleblower protections, for example, are technically there, but they doubt whether or not they could really blow the whistle in their workplace and actually, especially in small towns or small communities, you know, they would not find another job maybe, or they would be blacklisted in some way that was sort of informal. So yeah, we have the regulatory, we have the rules. We need a few more of them because a lot of the standards are either out of date or just takes a long time to get an OSHA standard through.
And they haven't kept pace with the changing workplace, have they?
Right, right, it takes time.
Now, your report set some goals for further work on these issues. Can you kind of outline for us what some of those goals are and how you think it helps you to better meet the needs of the people that you're actually serving?
Sure. Well, the first thing that we did was this paper and pencil survey where we kind of got with groups of people in the community around, you know, almost a schoolish kind of setting. Here's a survey, paper and pencil, answer these questions. At the last page, we had an open-ended, if there was one thing you could change about your workplace, what would you do? And then we knew after that the next plan would be to get into what people call qualitative research methods, to have discussions, to get around kitchen tables, if you will, and although they're not really in their kitchens, to get in groups in the community and have dialogue and really sit and listen and not assume that we know everything that's going on, but to really understand that those people in the community in the low-wage jobs are the ones who know what the problems are. And so the whole next phase, which is pretty much, we've been active right now at it, we did reach already 146 people to have these kind of group sessions, which, we record and take seriously everything that's said, and we're in the middle of analyzing, the kinds of things that they told us, because we really don't think we know as much as we think we know. Yeah.
Okay. One of the things that this study helps us to understand, particularly in, lots of places in New York State and here in the North Country, is what a critical component health is, of course, to quality of life in general, but how the workplace, when it affects your health, that affects your economic well-being, it affects your physical well-being, it affects everything. So how do you think this study is opening the door to a better understanding about what the kinds of things that we need to be looking at when we're looking at this population, which unfortunately seems to be growing, not shrinking, in terms of the low-wage workers?
Well, I'm under no illusions that just doing a small study in Syracuse is going to make monumental change. In fact, I really like it when the workers say things to me like, "Lady, do you really think this is going to matter?" And I get it, because studying things by itself isn't really going to really solve a lot of problems. But here's the couple of things we'd like, why we're doing this and why we want to see it. The report itself gets attention. It has gotten attention enough to start raising the question more often. Is this a society we want to live in? This one where everyone, or not everyone, but a good chunk of people are not able to make sort of a life story that's satisfying. I mean, it's very, very powerful when a fast food worker across the counter looks me right in the eyes and says, listen, this is not the life I imagined I would be leading. You know, this is really wasn't my plan. I didn't go in kindergarten and say, what do you want to be when you grow up? A fast food worker. You know, if they are working in these jobs, isn't there some dignity that should be imposed or brought to the work, and that starts with pay rates, right? So there's a lot of folks across the country, you know, having fights for 15, or, you know, people wanting to make a decent living wage, right? So I think that this kind of work, because it gets some attention, and we've put these reports in the hands of lawmakers, and we've spread the news as much as we can, does at least start to raise more awareness about it. And in terms of what to do exactly, I think we're a little bit premature to be giving a lot of detailed policy recommendations, but you know, we can definitely weigh in at times when we know that this issue and the future of work, the life in our communities should be different.
Okay. Well, Jeanette, I know it's going to be hard to believe, but we have come to the end of our half hour. It has flown by. I appreciate so much you coming in to talk about this. I think as you continue to progress with your research, we're going to want to follow this story, and certainly it is something that impacts far too many people, not just in the Syracuse area, but all across New York State. So thank you very much.
You're welcome.
Our time is up. These conversations are a production of North Country Matters, produced here in the studios of WCKN on the campus of Clarkson University. This show is a civic collaboration between the St. Lawrence County branch of the American Association of University Women, the St. Lawrence County League of Women Voters, and the Communications and Media Department here at Clarkson. Until next time, remember, our North Country matters.